is that is the furthest, the longest Dupixent has been studied in children is 12 months. But yet we're like, they'll be fine for years, decades, the rest of their life. And I was like, but in adults, we're seeing cutaneous T-cell lymphoma, which is another form of cancer in adults using Dupixent. Now, again, it is in adult males, 45 to 65. So we got to be exact. But these studies are like 20,000 people, right? And then it was within the first year of using Dupixent. So I'm like, okay, so in these adults, we're seeing cutaneous T-cell lymphoma. There's no genetic correlation. You don't pass it on with genes. So has nothing to do with genetics. This came directly from Dupixent. And then the question I have, like, well, what about a 6-month-old that is now 10 years old on this medication? What does that look like? We actually don't know. And to tell parents that, like, it's fine, you have no idea it's fine. You only know it's going to be fine for a year because the data is showing some side effects, of course, is not, but it's only 12 months. And again, when we're looking at Dupixent, we are not treating the root cause. We are stomping down the inflammatory pathway. But once you stop it, if you don't treat the underlying cause, with eczema, asthma, eosinophilic esophagitis, whatever you may be dealing with, is going to come back.
I've mentioned in passing many times that my son struggled with eczema in his first few months of life. And I think that if I had not found today's guest, Dr. Annamarie Temple, that he probably would still be struggling to this day. We did everything we could DIY, natural, and we talk about all that in this episode, but we were still struggling. And the doctor was telling us that he would have to be on steroid creams and possibly a medication for the rest of his life. So today I'm super excited to share an episode with our personal pediatrician and hope that this episode helps a lot of people. Make sure you head down to the show notes to get the link to Dr. Temple's website, her Instagram, and her eczema program if you're a family that is struggling with eczema, or maybe you're a grandparent of someone who has a child with eczema. This has been an extremely helpful thing for me and my family, and I can't recommend it enough. So please feel free to share this episode with any friends and family members who need to hear it, and I hope you enjoy today's conversation. Welcome to the Evolving Wellness Podcast, where circadian biology and quantum biology meet nutrition, lifestyle, hormones, health, and everyday conversations. I'm your host, Sarah, board certified in applied quantum biology by the American Naturopathic Medical Board and certified in nutrition by the National Academy of Sports Medicine. This is just a quick little reminder that you'll never hear a guest on this podcast whose every stance I agree with. And that's the point. These are conversations and not consultations. The information shared here is for information and educational purposes only and is not a substitute for medical advice, diagnosis, or treatment. Always seek the guidance of a qualified, trusted professional for all of your personal health needs. If you want more of my content, including my free long-form articles with citations, free ebooks, membership group with more access to me and my circadian app that helps you integrate light into your life seamlessly, make sure to visit www.sarahkleinerwellness.com. Thank you so much for listening and enjoy the podcast. Hello, everyone. Welcome back to the podcast. Today, I'm like extra. I know I say I'm excited when I start every episode, but I'm extra excited for today's guest. She has been just an amazing person in my life personally, and I have so much respect for her as a human, hard worker, just amazing person. So Dr. Temple, thank you so much for being here today.
I'm so excited to be here. Been looking forward to it.
Yes, me too. So let's just tell everyone a little bit about yourself. You're a pediatrician. You have your own practice. How in the world did you get into like this integrative approach and then even the whole eczema side of things?
So I'm traditionally trained at Chapel Hill for any Tar Heels out there. And in 2007, when I was already 5 years in my practice, my 3 kids were sick. They were all dealing with chronic issues from eczema, asthma, seasonal allergies, constipation, recurrent ear infections, ADHD. And one day I got tired of my kids being on chronic meds. And so I took the 3-ring circus to the doctor and I lined the ducklings up on the table table. And I was like, why are my kids so sick? And why are they on so many chronic medications? What else can we do? And for my little guy, they're like, well, because he was so severely affected by allergies, he couldn't even go outside on an Easter egg hunt because his eyes would swell shut and his tears would stream down his face. His body was covered in hives. He would be on the ground just ripping his skin off. And they were like, well, there's just no more medications we can give him. He was on 5 allergy medicines at that time. They said the only next step is allergy shots. He was 2 years old.
Oh, gosh.
For my daughter, they're like, oh, well, for asthma, we'll do inhaled steroids. For her eczema, we'll do topical steroids. For her seasonal allergies, we'll do an antihistamine. And then for her chronic constipation, we don't have to worry about it because Miralax is working. And she'll eventually outgrow her ear infections. By the time we got to my middle one with this snot, like the kind of boogers like you would never be allowed out of your house these days, and his ADHD, by the time we got to his snot and his ADHD, like I had stopped paying attention because I felt dismissed. I felt that they thought I was crazy. No one paid attention to what I was really trying to say. So I walked out of that office and I'm like, wait, are they saying that really my children's story is that they're going to be on chronic medications for the rest of their life? So it's like this, I refuse to believe that that's the end of the story. And when the mama warrior wakes up, we all have the mama warrior when we give birth to our children, but then she really wakes up. She's like, wait, what? And the mama warrior in me was like, yeah, no. This is not the rest of the story. We're going to rewrite the story. I don't know how we're going to do it. I don't even know the next step, but I know that these kids are going to come off their chronic medications and they're going to be the example by which other families are going to heal their children because of what they have done. So I didn't know what I was doing. So a week later, I went to my kids' school. There was like a nutritionist giving a talk, and I always went to the school stuff to support them. And I walked in like a know-it-all, and it was on that Tuesday morning, 7:30 in the morning, freezing my butt off in a first grader's classroom where the fog lifted and I realized the root cause of my children's illness. All that the lady talked about was sugar. I thought I was doing an amazing job because my children had strawberries for lunch and broccoli at dinner, and I felt like I was giving them fruits and vegetables. I did not realize the amount of added sugar in my children's lunches on top of all the other ingredients until this lady did a simple demo. So that night I came home after clinic at 7:30 with my stilettos on. I went into the pantry and I threw away the Cinnamon Toast Crunch, the Lucky Charms, the juice boxes, the chocolate milk, you name a garbage, my kids were eating it. And that's when I became an outcast in my family. My husband and I proceeded to fight over food over the next 5 years. My friends and family thought I lost my mind. But as a mama warrior does, despite the naysayers, we keep on going forth. And over the next 5 years, my kids stopped needing medications, no more antibiotics, no more steroids. By 2016, my husband and I quit our jobs and we moved to New Zealand. We had no doctors, no medical insurance, no medications. And I watched my children thrive. They climbed the highest mountains and they bungee jumped off the tallest bridges. And that's when I realized what it looks like to come back from chronic disease. So in 2018, when I came back to the States, I wasn't going to do the same way again. We are going to do it differently because I was able to practice medicine differently in New Zealand. And I just went through my own children. We were able to turn around chronic disease. And I wanted to do that for other families.
That's such an amazing story. And I'll just say, as a person who drives from Atlanta up to your office to Charlotte, you really do work so hard to support so many children and so many families all over the world, all over the country. And you do walk the walk. There's a lot of doctors out there on Instagram and TikTok or wherever, and they just spout off fear-mongering information, studies, but they're not actually working. They're not rolling up their sleeves, getting their hands dirty with patients, with children, with families. And I drive up there, we're up there, and you're fully dressed, makeup, looking fabulous at 8:00 in the morning, and seeing patients, and it's just, I'm in awe of somebody who really does put this stuff into practice, not just with your own family, but with so many other families. And I know that I can speak for a lot of the other people in the eczema program that we appreciate the hard work that you do and showing up the way that you do. Because there's not pediatricians, you ask them about diet and they kind of just look at you like a blank stare. You know, it's not a conversation that a lot of them even really have, other than, you know, don't feed your children soda. Maybe they might mention that, but they don't go so far as to say maybe all these processed packaged foods that you guys are eating are contributing to some of these health issues, right?
Yeah, and it's unfortunate because a lot of times I hear, well, food, there's no evidence to show that food has anything to do with eczema.
Right.
And I want to scream because we have so much evidence on processed foods, on food coloring, on added sugar, just to name 3 different things when it comes to nutrition and eczema. Now, again, now the doctors would be like, okay, well, yeah, I'm all for kids having less processed foods, but they don't believe that there's data on it. When in medical school, it's almost like this bias. Like when we were in med school, because you didn't learn in med school, there's this theory that it must not be there. And also, you know, when I worked in the traditional practice, I was seeing patients every 10 minutes. Mm-hmm. When you see patients every 10 minutes, your energy bucket is empty by the time that you're done with your day. And then you have 3 hours of charting to do. And then somebody said, hey, do you think vitamin D can help my kid's eczema? You're done. You're mentally finished because, again, you haven't learned it in med school. It hasn't come across your journals. Your colleagues are not talking about it. And you've seen 30 patients that day. You have all these messages to return. You don't have the energy to look one more thing up because the system that physicians in the traditional model work under is promoting sick care and money for the hospitals. It's not even for the doctors, because one of the things a lot of people are like, the doctors making money. No, the hospitals have taken over. They've gotten physicians pay. The people who are profiting are actually big hospitals who call themselves for a nonprofit. I get very upset about this. Yeah. And it's the suits. And then because when I was in that practice, you would get dinged by the hospital if you spend more than 10 or 15 minutes, whatever they allotted for you, with your patients. There was like a special column. They're like, you're not seeing enough patients. You're not referring enough. So there was like, and then your pay depends on, are you seeing enough patients and are you referring enough? And that's not okay. You don't have that time to be like, hey, let's talk about vitamin D. Micronutrients, wow, that's so interesting. Tell me what you found. Okay, I'll look that up because I have the time and the energy and the mental strength to actually broaden my mind and broaden my horizons because, right, science is changing all the time with technology and now we have open language models. Information is changing like literally every 72 hours. Yeah. So you have to be open-minded and continuously researching because it's always moving. It's always changing, but you have to have the opportunity and the energy to have that time.
You might have noticed a lot of viral posts about methylene blue lately on the internet, and there's a lot of fear that you could potentially turn your brain blue and cause toxicity issues. But what those articles aren't telling you is that those doses were 100 times higher or more than the standard dose. Now, I have actually been using methylene blue personally and have several clients that also use it. And when I choose my methylene blue, I choose Transcriptions because it is a physician-led company. They actually had 4 physicians that have used their real-world clinical experience to develop extremely effective health optimization solutions. It's pharmaceutical-grade quality because Transcription sources high-quality ingredients globally, subjecting each to rigorous testing to ensure unparalleled purity and potency. It's easy to dose. These buccal troches are actually scored so you can divide them down into a tiny little dose to try it out. I use it for mitochondrial optimization when I've had a night of poor sleep or if I am flying. If you want to try out the brand that I use and trust, go to troscriptions.com/Sarah K for 10% off of your first order. That's troscriptions.com/Sarah K for 10% off of your first order.
And I love that you explain it that way because I think as someone who is on social media a lot as well, just like yourself, I'm sure you see this thing kind of with the alternative holistic health community where they demonize doctors and they just say doctors this and that. And the thing is that I don't think anyone becomes a doctor because they want to hurt people. I don't think anyone gets into medicine because they have malicious intent. I think they want to help people, but the system is what is setting everyone up to fail. And the doctors are included in that failure system.
Absolutely. You know, when I was in New Zealand and they were like, well, how long would you like your patient visits to be? And I was like, what? I'm like, an hour. They're like, done. I'm like, really? And then they're like, what about follow-ups? I go like, 30 minutes. They're like, no problem. I'm like, no problem. And in an hour, I could do dietary recall. We can dig into fears that the parents have. We can dig into what have they investigated. I had the time and the energy to sit back and go, okay, tell me what you've, okay, let's explore this thought. Let's talk about this, let's talk about the root cause. When you have an hour, you can really dig into the root cause of your child's issues. In 10 minutes, you don't. In 10 minutes, you have time to write a referral to a gastroenterologist or a dermatologist to then go to the derm, for example, and they have 5 minutes. They don't even have 10. And they give you a topical steroid, topical antibiotic, or Dupixent.
Yep.
The end.
Mm-hmm. Yeah, that's where we were with my son, because they basically at 6 months old, this allergist said that Dupixent was going to be the only thing for him because he just was so reactive to everything. I mean, it was very bad. I haven't shared photos of how bad it got for my son, but he had fallen off the growth chart. It was so bad. And I know you get kids like him also in your practice. And we were holistic, and I was down to eating like 4 foods, breastfeeding. And the allergist was like, yeah, I'm sorry, he's just going to have to be on Dupixent. And that's the end of the story. And so that's when I had someone, I think it was someone that was kind of in my quantum biology community, said, oh, you should follow Dr. Temple on Instagram. And I found you, and I was like, done. Okay. Just, joined the eczema program. And then shortly after said, you know what, I'm just going to drive up there because we need help, and got him out of the flare. And now he can eat. He's eating. I didn't even tell you guys on the last call, he's eating eggs now. He used to have almost like an anaphylactic reaction to eggs. And now he's eating eggs. Fine. Totally fine. Not even a flare on the skin. So, and this is after working with you guys since he'll be 3 on Sunday. And we started in the program when he was 6 months. So it takes time. It really does take time. But the standard model will just, even if you're down to like 4 foods, because I'm bought into the food stuff, but he was still reacting to everything. They were like Dupixent, And so this is something that people need to know about, because I don't want to, what are the downsides of Dupixent? You've been posting on that lately. And I find that, because I always just was like, no, intuitively no. But aren't there some pretty nasty downsides to Dupixent for kids?
Yeah. Well, so Dupixent, it's termed a biologic, which drives me nuts, because then they're like, no, it's not an immunosuppressant. It is absolutely immunosuppressant, right? It actually stomps part of the immune system so the child doesn't overreact to and have eczema and eosinophilic esophagitis, asthma, etc. Like, it stomps part of the allergic pathway. When you stomp part of of a pathway, there's another path that will, because the body always finds a way. Mm-hmm. If you block a way, the body finds another way. So Th17 is a pathway that can become overactive. And so people on Dupixent actually can have worse eczema symptoms. They can develop psoriasis. They can develop redness. For the immune deficiency aspect, you can develop viral infections, parasitic infections, because again, it's an immunosuppressant. My big beef with it is that it's given out like no big deal. Mm-hmm. It's like, okay, well, the only option is Dupixent, and they might be on it for years or the rest of their life. We don't know, right? And when we look at the actual medical data, there's 2 studies, one of 192 kids and another one of 200. The one study is 6 month old to 11, and then we have an older age group. Both studies go as far as 12 months. That's it. That is the furthest, the longest Dupixent has been studied in children is 12 months. But yet we're like, they'll be fine for years, decades, the rest of their life. And I was like, but in adults, we're seeing cutaneous T-cell lymphoma, which is another form of cancer in adults using Dupixent. Now, again, it is in adult males, 45 to 65. So we got to be exact. But these stories are like 20,000 people, right? And then it was within the first year of using Dupixent. So I'm like, okay, so in these adults, we're seeing cutaneous T-cell lymphoma. There's no genetic correlation. You don't pass it on with genes. So has nothing to do with genetics. This came directly from Dupixent. And then the question I have, like, well, what about a 6-month-old that is now 10 years old on this medication? What does that look like? We actually don't know. And to tell parents that, like, it's fine, you have no idea it's fine. You only know it's going to be fine for a year because the data is showing some side effects, of course, is not, but it's only 12 months. And again, when we're looking at Dupixent, we are not treating the root cause. We are stomping down the inflammatory pathway. But once you stop it, if you don't treat the underlying cause, with eczema, asthma, eosinophilic esophagitis, whatever you may be dealing with, is going to come back. Mm-hmm. Now, is there a subset of people that will do Dupixent for 6 months and be better? Yes, because there's always a bell curve, but that's a small amount. That's not the norm. That's kind of like people use topical steroids for 3 months and then their eczema is better. Okay. Right. Well, that's not the majority of people. Yeah. But the concern I have is a powerful medicine to little people that we don't have long-term data on. And it's a massive immunosuppressant that does not address the root cause.
Yeah. This was the same allergist. We went in and he had molluscum and I freaked out and he's like, yeah, he needs an oral steroid immediately. And I called your office and you guys said, no, here's a homeopathic remedy, which we can't even get anymore. I had to find a bunch from eBay because they took it off the market, but that actually fixed the molluscum within a couple of weeks. It was totally gone. And I've watched some of your molluscum videos that totally freaked me out because I know it can last for like a year for some kids, but immediately I called the office because I knew intuitively, why would we give steroids for a viral infection? I don't understand why we would do that. But we don't know better as parents. Like we're trying to do the best we can. People have jobs. They're busy. They're just trying to keep this little human being alive. And so if the doctor says to take this medicine, to do this thing, they're just a lot of times going to do it because they're never given they don't get informed consent on these things. And then we have all these other issues. You mentioned the whole eczema. A lot of that time that will eventually turn to asthma. Is that correct?
That is correct. Yeah. People are like, oh, they will outgrow eczema. I'm like, no, you don't outgrow eczema. Eczema shapeshifts. Eczema moves from your skin. The immune system stops attacking your skin and now attacks your lungs, as asthma attacks your sinuses and face for seasonal allergies. Or 30% of kids with eczema develop food allergies. Mm-hmm. That's not incidental. And people are like, oh, my eczema resolved. I'm like, no, it didn't. It's just the inflammation from your skin moved to other organs because it's a shape-shifting kind of a situation. It's called the allergic march. And it was funny when I talked with traditional doctors and I'm like, yeah, in our program, what we do is we stop the eczema going to asthma, food allergies, seasonal allergies. And then they're like, well, that's just the allergic march. It's kind of, so in med school, we're just kind of taught like, well, that's just what happens.
It's inevitable.
Like,
right?
Not much you can do about it. That's just kind of what happens. And I'm like, wait, but we are in power. We are in charge of our bodies. We're in charge of turning on genes and turning off genes. It's called epigenetics. We are in charge of turning off genes that we will not pass on to our children based on the diet and lifestyle that we have. We have control of this. And unfortunately, and I'm so sad that, when in medical school, I went to a great medical school in residency, but this is just what it happens. It was a very defeatist way of looking at the human body, like you just get cancer, nothing you can do about it. Right. You just get eczema, nothing you can do about it. And I'm like, but wait, Right. But wait a minute. But could what I do actually affect the outcome either for myself or for my children? And, for my kids who were already on the allergic march, for me to accept and put them on allergy shots, I would have done a great disservice if I didn't dare question the status quo. Mm-hmm. Because, I'm a mom. I have 3 kids. I'm working a full-time job. My husband's working a full-time job. To your point, we're busy. And I'm like, wait, I'm trusting, I of course, trust the medical system, but I'm like, wait a minute, what? This many medications in a 2-year-old. I'm like, I got to the point where I was like, what? And then allergy shots are for years to life. Mm-hmm. And I'm like, what? And again, but if you're in a desperate situation, your child is covered in eczema from head to toe, they're bleeding, they're scratching, you haven't slept in 7 years, right? Right. And then the doctor's like, the only option is Dupixent. You as the parent are like, well, okay, obviously the only option is Dupixent. Obviously that's what I have to do because there's nothing else.
I'll be honest, this last year, I've definitely noticed some signs of aging as I am 46 in June, and I'm always looking for natural, holistic ways to support my body. I've been a big fan of red light therapy for many years now, and recently started using the Bon Charge face mask to help my body produce its own collagen. Now, here's the thing that differentiates Bon Charge face mask from the rest of the ones on the market. It has specific wavelengths that are actually meant to target the skin and collagen production. It has been shown to reduce fine lines and wrinkles, and it is low EMF. So it's very safe to use. When you're actually going to have a device on your head, you want to make sure it is the lowest EMF possible. I have tested this with my own EMF meter and believe it is safe and recommend it to clients. So if you're interested in checking out the Bon Charge face mask, I have a special discount for podcast listeners. You can go to boncharge.com and use the code Sarah Kleiner, all one word, for 15% off site-wide. I really love the Bon Charge red light face mask. And if you're looking for more natural ways to support your body in this age and stage of life, I recommend checking it out. Go to boncharge.com and use the code Sarah Kleiner, all one word, to save 15%.
Right. Exactly. You get to that point of desperation, and I totally understand it. There were times with my son that when he wasn't sleeping, I thought I was going to just lose my mind, honestly. And he was the type of baby. Now he's different. He's about to be 3, but the only way I could get him to nap was to hold him. Otherwise he would just scratch and scratch and scratch. So I had to hold him, hold his arms, hold his legs to get him to be still enough to take a nap. And the same thing at night. He wouldn't sleep unless you were physically holding him. He couldn't sleep in a bassinet, or he'd sleep in the bed with you. And then, it wasn't sustainable to have to hold a baby. And then he was miserable all the time. And I saw this when I got into your program, that there were other families like mine. And I felt so, okay, I'm not crazy. This is actually a thing that happens, but you can't drive in the car because you've got to put socks over their hands. Otherwise they're going to claw their face is going to bleed. I don't think people understand the extent to which these children and the families as well are suffering because of the eczema and just all the things that these little bodies are having to deal with now.
Right. Well, a lot of times for a majority of people, they'll know that somebody has eczema. It's like a small little patch.
Yeah.
It's just like
a little
so they're like that. When you say eczema, it's a little patch. I'm like, except for a lot of kids, that is the whole body and their whole face. And when you hold them, they actually rub their face against you because they're trying to scratch their face because you're holding down their arms.
Yeah.
Right. And then if you in a car, then they use their little feetsies and they go back and forth until they grab their socks off so they can really dig. And by the time you get to the store, the child's a bloody mess.
Yeah.
And then you go in the store and everyone's like, wow, your child has eczema. You should do something about that. You got, thanks. Appreciate it.
I wouldn't go anywhere. I just wouldn't go anywhere because of that. Oh, just shut up. Go away. I'm eating 4 foods. I'm doing everything I can. I'm not sleeping, and making the parent feel worse is the worst thing you can do. People just don't understand the extent of how much everyone in this situation is suffering. And my question when I got in the program to you and to everybody was, how in the world did this happen? Because I did not have a C-section. I had a natural birth. He stayed on the cord for 10 minutes. I had no vaccines myself. I gave him no vaccines. He was not circumcised. I tried to do everything, breastfed. I tried to do everything. And so when this happened, I was just shaken to my core of how in the world this could happen. And honestly, like in your program, you do talk about C-sections and diets and environmental things, but I know you also get moms like me, because I met a few of them in the program. Why do you think that we're having kids like as sensitive as my son now? What's your explanation for those types of cases?
Right. So you brought up several things that probably a lot of moms are struggling with. Right? The dietary during pregnancy is huge. You already knew about that, but a lot of moms didn't, right? When I had my children, I did not know. I knew about don't eat raw seafood, cold cuts, right? And then don't smoke, drugs, alcohol. But no one was like, hey, you should lay off the sugar. Hey, you eat whole foods. You need to eat a lot of plants, a lot of plant points, a lot of wholesome organic meat. That wasn't a thing in circa 2000. And no one, right? So we have nutrition for both parents that is super important during pregnancy. No, the traditional teaching is like, you could eat whatever you want because you're pregnant. I'm like, no, actually you can't. You have to be even more conscious because you are creating a little life, and that depends on what you're eating. What supplementations are we taking during pregnancy? Do we have enough vitamin D? Do we have enough zinc? Are we on the right probiotics? Because as mamas, we think that we're eating the right diet, but the probiotics depend on what comes from our food. And if the food doesn't have the right probiotics, one strain, particularly Lactobacillus rhamnosus, when taken in pregnancy, especially in the third trimester, we have several studies to show that it decreases the rates of allergic disease by over 50%. Okay. And that's huge, but no one talks about, hey, listen, let's make sure that your probiotic has Lactobacillus rhamnosus in there, because we have data that is strong enough. Is it 100%? No, but it's strong enough to show a reduction in allergic disease. Then you talked about C-section versus vaginal delivery. Antibiotics at birth can make a huge difference, of course. What we put on our skin before pregnancy and during pregnancy, all those chemicals get absorbed into our bodies, right? Whatever we clean our house with, whatever detergents, whatever lotions, cosmetics, what are those ingredients that are being absorbed? I believe that they found about 293 chemicals in cord blood from just environmental exposures of pregnant moms. We don't even realize a lot of time this stuff we come in contact with. And one of the things, and I think this is applicable to you because I know your story, is I think stress. Stress is an under-recognized toxin. Yep. And in our American culture, we're all so stressed out. Yep. We don't even realize how stressed we are, if that makes sense. It's kind of like when everybody around you is at a level 10, you're level 7, you're like, I'm doing good because I'm level 7. But when I moved to New Zealand and everyone is a level 3, and I was a 7, I look like a complete nutcase. All the Kiwis were like, what is wrong with you guys? It's just from the way they walk, from the way they talk, from the way they interact, from the expectations on the children, from the way you go to school. It is all these microscopic things we don't even realize because we lived in a stressed out country. Yeah. And so we think we're doing good when we're not. And, for people to Google, because you're like, what? So the ice storm in Canada in 1998, there was a massive storm in Canada. It's a great ice storm, and 600,000 people were displaced. And some scientists were like, you know what? This is an amazing opportunity to study. I'm like, what? And so they looked at pregnant moms in Canada who were displaced by the ice storm. This is exceptionally stressful, especially during pregnancy. They have to stay on people's couches. They had to stay with mother-in-laws, their cousins, friends, etc. So they had no home. And they compared the moms that were displaced during the ice storm and compared them to Canadian moms who were not displaced during the ice storm. And they followed them out for 15 years. And what they found is the mamas who were displaced during the ice storm had children with high rates of eczema, asthma, ADHD, autism, cancer, diabetes, neurological issues, ADHD. I mean, the list goes on, and it's called the adverse events of childhood. Yes. And that is a massive toxin in our bodies when our babies are bright. Well, I was in residency with two of my babies, and my sickest one being my firstborn. I was in the midst of residency. I'm doing all the shift hour, all the stuff. She ended up being a C-section. I ate garbage. No one talked about my stress, all the things, everything that you shouldn't do, I did. So if anybody wants to know, people are like, I feel so bad. I'm like, I did the best I could with the knowledge I had at that time. But if we want to look back at, I can make anyone feel better. I'm like, let me tell you what I did and what happened. But back to your question, I think the stress in your life with what's going on in your personal life had a massive impact on you and what was going on with your little without you even realizing, because as moms, we just kind of go on with life. Like, what are you going to do? Pause because this is happening and that? You just keep going.
Right.
You're building your business, you're building your brand, you're taking your, all the things. Well, that is a big stressor on the baby.
Yeah. I think we just downplay our stress. And for me, when I was pregnant, we moved into this house. And as soon as we moved, my daughter started having really bad behavior flares. And then when James was a baby, she had her very first grand mal seizure. She had never had one before, but he was sitting in his car seat facing the back seat. And she had this huge seizure like right in front of him as a baby. And I was like, obviously just terrified. I thought she was dying. I mean, it was the scariest thing I've ever seen in my life. And he's just this little baby, and he sees his sister now that he's older. He thinks that she's the most amazing person in the world. He follows her around everywhere. He tries to hold her hand. He tries to hug her all the time. And she tries really hard to tolerate it, but they have a connection. They had a connection, I think, before he was even born, because she's like spelled about it on their letterboard, how she could communicate with him while he was in the womb. And I believe it. So I think that definitely played a role for him. And he's just, he's so sensitive. He's so sensitive. But the good news is that you've been able to help us. And now he's something that was once considered anaphylactic. He's eating it. And that's pretty amazing. And he's not on a bunch of creams and he's not taking any steroids. And so there is hope. And maybe I will share some of the photos. I don't know. I'll think about it, but it was bad. It was really bad. And one of the things that we've done with you that I talk about, and maybe we can go into this as well. And this is something, I'll share the link to the eczema program underneath. I don't know if you do. I think people have to come to your office if they want to get LDA. But I think LDA has been...
Oh, no, we can do it in the eczema program. No, we could do it in the eczema program. Yeah.
Nice. Okay, good.
Yeah, we brought it to the eczema
program. Coming up there. We're going to be up there again in a few weeks. So I've got family in Charlotte, so it's always nice to go see my uncle and spend time with them. But so if you want to do the eczema program, you have LDA for those people as well, right?
Yes. Yeah.
So what the heck is LDA? Because I do think that has been on top of everything else we've done, because we do some supplementation that's tailored to him. What is LDA and how are you seeing it help some of these kids?
Yep. So it's called low dose allergen therapy. And to bring it to most people know allergy shots. So for example, allergy shots, you get tested by your allergist and you're allergic to oak. So then they take a small amount of oak, they put it in a syringe with some ingredients, and then they shoot in your arm once a week for years, forever, etc. So allergy shots are for the environment. And it comes with the shots and other ingredients, etc. Then we have OIT, which is oral immunotherapy. That's only for food for those who are anaphylactic and they're children, not for adults. And when you have, you go into the office and you get a small amount and then you go home and you have to do like teeny tiny amounts every single day, and they increase the dosing. So you start getting used to the food that is causing anaphylaxis. And then we have sublingual immunotherapy that you go to the allergist, they do skin patch testing and see if you're allergic to foods and environment, and whatever you're allergic to, they pick the highest ones and they put them in a vial and you do them under your tongue 2 to 3 times a day for years to come to become sensitized to those. So LDA is even broader than all of that. You don't have to do any allergy testing. You don't have to do blood work testing. what it is that it doesn't, in LDA, you get 200 things from the environment and 200 things from food. And the reason that's the case, because if you were just, let's say we talk about the egg allergy, you're not just allergic to the egg.
Right.
You're allergic to the egg enough that it shows up on a skin test, and you're allergic enough that shows up on a blood test. But you could be allergic or sensitive to gluten, dairy, egg, soy, peanuts, grapes, watermelon, Brussels sprouts, dog, cat, pollen. But there's tiny, small amounts that you're not capturing it on a blood test. But when it's a little bit and a little bit and a little bit, because like we always talk about, the body is a cup of inflammation.
Yes.
So if in that cup of inflammation, you're a little sensitive to gluten, a little bit to dairy, and a little bit to peanuts, and a little bit to the cat, a little bit to the dog, and mold, and ragweed, and oak, and whatever, all that adds up to a lot of inflammation. It's like a terrible math problem. So it adds up to all this inflammation. And what we do with LDA, we treat the body from all aspects to make sure that it's becoming tolerant to the environment and the foods. And we do it in such small quantities, almost homeopathic doses, very, very tiny. And you do this dose once every 7 weeks, in addition with an enzyme called beta-glucuronidase, which we all make. And the beta-glucuronidase stimulates the Treg cells. Tregs are very important for balancing the immune system. So when we present what we call the antigen, so these 400 different antigens to the body with this enzyme, we teach the T regulatory cells, who are born every 7 weeks. So the little baby Treg cells get the information, hey guys, we're not going to freak out over all of this. Let's simmer down. And then over time, the old crusty Tregs that are annoying, they die off. And so we're always teaching the new guys. And over time, we have more and more new Tregs that have realized that we're not going to get ticked off at the environment and food. And lo and behold, you start tolerating food. You're no longer reacting to the cat. You're no longer coughing and having asthma in the fall, because the immune system has simmered down with a gentle presentation of this every 7 weeks.
Amazing. Yeah. And we do it. And it's not, as my husband at first, he's like, does it have adjuvant in it? Like the vaccines? Is it, any potential for, and I'm like, nope, it's none of that. It's totally, no risks of that stuff. Right.
Correct.
Yeah.
Correct. No preservatives, right? No formaldehyde, no aluminum, none of that. And it's funny because I'm like, well, it is made in a pharmacy because we don't really want someone in their basement making it. You know what I mean? Because I had somebody there like, well, it's kind of suspicious it's coming from a pharmacy. I'm like, it would be suspicious if it didn't come from a pharmacy.
Right.
So I'm like, they have to have very specific rules how to mix this that we're going to put in the children's body.
Right. Right. I think the holistic world has swung a little too far in some regards, that we just have a complete distrust of medicine completely. I get it. Trust me. I completely get it. But when it comes to these sorts of situations, we need people we can trust. And that's why I was excited to bring you on, because I know I've got a lot of those people and parents in my community, and I'm always, this is a good person. We can trust her, right?
It is. It's scary these days. I mean, with social media, whether you're an MD, whether ND, a chiropractor, health coach, but just because you have initials behind your name still doesn't mean it doesn't necessarily mean that they're trustworthy, not trustworthy. To your point earlier, like, people don't go in healthcare to be bad, do bad, take advantage of people. It's just how they're trained, and then we're humans.
Right.
It's humanity. At the end of the day, it's humanity. And there's a cognitive bias, which means, you start believing certain things, which then appear in your life, and then you believe them more. And then in our current culture, we're intolerant of the opposite view. And the intolerance is growing by the day. So if somebody has a different view than you, we are just so quick to judge, to put our heels in the ground and be like, that's not it. And I have a study, rather than approaching the opposite side with curiosity.
Right.
And when we approach the opposite side with curiosity, this is when our mind broadens. Oh, what? Acupressure for eczema? That sounds amazing. Okay. Even in Dupixent, when people will come to me and they're super sick and they'll say, oh my God, I'm thinking of Dupixent. I'm like, yeah, we talk about the risks and benefits, but there's some people that cannot even make a dietary dietary change because their child is in such horror. And they're like, the only way we can make a dietary change, if we can get a little relief, is it okay for us to do Dupixent for a few months to see if we can get relief so we can actually work on the root cause?
The changes.
That's being open-minded. I'm not going to blast it. I'm not going to make the parents feel horrible because they want to do Dupixent. I'm like, let me support you in that. And let me explain how we're going to work with Dupixent, with homeopathy, with herbals, with supplements, and then we're going to be done wean off the big pharma, but we will use big pharma when we need to, and we will use acupressure, acupuncture, we will use massage therapy, and sometimes we use energy work. Being open-minded and curious to things that you don't know and things that maybe you don't necessarily believe in helps us improve our children's life and well-being rather than being staunch and no, it's my way or the highway kind of thing.
Right. That's where I think that a lot of people get put off by doctors is that that's it. Here's the medication, bye. And I'll just speak from experience. James, I suspected he was getting an ear infection because my daughter had chronic ear infection. So I kind of know what it looks like. And I called the office and I was given some suggestions to help in case it was, to prevent it and to help him through it so we could avoid doing a round of antibiotics. And lo and behold, it worked. So we didn't have to use the antibiotics. We were able to use things like homeopathy, integrative approach that didn't involve drugs to stop it. So he didn't need to use antibiotics. And so I think that's the problem I see with a lot of pediatricians, a lot of medicine. Number one, they don't have the time to do this integrative approach. And two, it's just, that's it. That's your choice. Antibiotics, steroids, the end. And what you're saying is sometimes maybe we would have to use the medication, but we have to support the system so that it doesn't become a chronic cycle and we just keep on pushing those symptoms down, right?
Right. And sometimes I think we can be so on the natural side that then we're like, but you know what? We can solve this problem. That's an acute problem. So modern medicine is amazing for acute problems. You have meningitis, we have a solution. You have bacterial pneumonia, we have a solution. You broke your femur in a car accident, we have a solution, right? That's acute care. The problem has become that we've used acute care model to treat chronic issues. That's where the issue comes. But because we've become so distrusting of it, I become so distrusting of everything. Everything is horrible and weird. And I have to tell people, and they're like defeated. I'm like, sometimes, for example, a pharmaceutical that I use is fluconazole, which is an anti-candida medication. It is prescription medication. And I'll use it because I've tried various herbals of various strength and I cannot get the positive effect that I can get with fluconazole in children with eczema. I can help children with eczema overcome their flares by decreasing their candida load using this medication. And so I have to figure like, I don't want to use pharma. I'm like, I'm with you, but we're going to get there better, more effectively than not. So then again, we have to have this conversation because like now I just stress it all. And I'm like, well, this is not our long game plan. This is not forever on fluconazole. This is a short treatment to fix a specific problem that most often occurs after children have been on antibiotics. To your point about ear infections, antibiotics are a huge trigger to eczema, and 90% of babies will have at least one round of antibiotics in their first year of life. 90%.
Yeah.
And when 90% of babies have antibiotics, well, guess what? And then mamas during pregnancy, mamas before pregnancy, that leads to yeast overgrowth, which necessitates a fluconazole, for example, to help aid in decreasing the candida load, which then helps us resolve eczema.
Yeah. Yeah. So there can be a time and a place. I think we resisted the fluconazole. I think you guys had wanted to do that. I think we did uva ursi or something like that instead, and it ended up working. So we were able to avoid it. But yeah, I think there can be a place for sure.
Right.
Yeah. You guys always you're good about giving us options. You're like, all right, well, you don't want to do that. Let's try this one first and then see what happens. And I like that better than just like, that's it. You got to do that. And then most pediatricians are not even going to consider candida as an issue. They're going to look at you like you have three heads. If you say the word candida, like Did you make that up? Where did you get that? They're not going to listen to that, right?
I have a great story for you. So one of my team members, she was dealing with eczema after the birth of her third child. Never had eczema. All of a sudden, after her third child, she had eczema, and a huge stress component to it, of course. Anyway, she went to a dermatologist because she developed, it's called tinea versicolor, which is a fungus infection on your back, oftentimes, or sometimes it could be on your chest, and it's like this very light colored splotches. So all of a sudden you're like, what is on my back? And these looks like somebody spilled something on your back. And now it's like you have all these white patches on your back. And people worry it's vitiligo. It's not, it's a fungus. And so they put on fluconazole for the fungus, the tinea versicolor on her back. Lo and behold, her eczema cleared up. And so she went to her derm and was like, oh my gosh, as a follow-up, she's like, so fun fact, the tinea also got better, but my eczema resolved. So I think there's a fungal component to my eczema. And the derm goes, oh, that was coincidence. That's just no way. That's
of course.
And I was like, wait a minute. Because before, like she was doing all the things that we were talking about, and she was not making a lot of headway. She wasn't controlling her stress specifically well, but she was doing all the things. And then when she did the fluconazole, it was like, boom, like it was like literally just everything like resolved. And the derm just was like, nope, that's just a coincidence. I have kids in the eczema program who, they're in a horrible condition, and they'll go to their allergist or pediatrician they've told them that you're just going to have a kid with eczema and we're going to deal with this forever. And the allergists often go, well, I guess we're going to know each other really well because we'll be seeing each other for the rest of his life, right? That's usually a comment.
That was our allergist.
And when they come in clear, oftentimes, do they say that?
Yeah. He said, we're just going to know you for the rest of his life, probably. And he was the nicest guy. But I walked out of there and I said, I'm never coming back to this stupid place ever again. And I haven't. I've never been back.
Right. But I mean, that's a common thing. And I have kids that go back and their skin's clear there. It's not often, but sometimes they were like, oh, I guess they outgrew it. After the parents have put like months, years of work into what's going on. And it's like, oh yeah, I'm like, okay. But thankfully, but I'll tell you, the tides are turning because I'm getting more and more derm referrals. The dermatologists are actually more open-minded than the general peds. I'm not sure I think because I'm a pediatrician, maybe they kind of, who knows. But I'm getting a lot more referrals from derms. They're really pumped about the results that they're seeing. So when the families are going back and the kids are looking better, they're like, well, majority of them are like, well, you can't argue with the results.
Right.
They're like, this is amazing. Wow. I had no idea. You know what? I'm just going to send my eczema patients over there because whatever you're doing obviously is working because these kids are in such terrible shape. And so then I'm always like, if you could go back and just, not you, but I'm like, go back and like show them that it actually works, kind of stuff. But fun fact, we begun clinical trials in the eczema program, and it looks like we're on track to be published next month in a major medical journal to show that nutrition and supplementation can reduce eczema symptoms by 50% at 6 months.
That is amazing. That's really exciting. I love that. Because again, people, they want that sort of information. They want some sort of scientific validation, or where's the study? All right. We got you covered.
Sure. I'm the same way. I'm always like, where's this? Right? I'm always like, everything I do in the program is like science backed. And so I'm super pumped to be like, okay, well, we're going to be science backed because you're like, oh, you got your doctor on Instagram. That's weird. I found you on YouTube. Weird. But when you're like, but actually now here's the published data. I was like, oh, I'm now paying attention.
Right. Exactly. And it's good that we have these mediums that we can connect with one another, because I probably would be on some sort of a spinning wheel with my son, because like I said, I was really down to 4 foods, not sleeping, thinking I was the worst person in the world. And the Dupixent was sounding like lucrative. I wasn't going to do it, but I was getting to that point where it was divine intervention that it was recommended that I find your page and get into the program. And here we are 2.5 years later. My son, he had to wear the little wraps around his arms and legs. So many of his baby.
When he came in the clinic, oh my God, with his chunky self and all his wraps. Oh my God, I still have like this picture of him.
Yeah, buddy with his wraps. And he didn't wear wraps at all this summer. I just realized it. I said he didn't he didn't need the wraps at all. He went swimming in the pool. He runs in the grass. Now he still scratches up his face in the grass because his skin is so sensitive. He'll just go jump in the bushes because he's a boy, but it's remarkable that he is just doing so well when we were told, oh yeah, you're just going to know us forever. And he's eating all the foods that he couldn't eat before. My husband even let him have some milk, God forbid, which was another one of his huge allergies because he's been asking for milk nonstop. And he drank milk and we were just sitting there watching, like we got the EpiPen, like, fine, he's fine. And he's like, more milk, please. Like, okay, I guess he's okay with milk now. So it is very possible to get your kids out of these places, but it does take work. And I think one thing I wanted to bring up was you and I are definitely, because I think this whole like Tylenol autism thing has been in the news. And one, I guess, thing I've been hearing a lot of people say is they're blaming the moms. They're blaming the moms. And you said this multiple times already in the conversation with the whole eczema thing. You were doing the best you could at the time with the C-section, with being in resident. You didn't know any better. And I think that's the message that those of us that are kind of in this more holistically minded place to put out there is that we're not in any way trying to make anyone feel bad for not knowing better at the time, right?
Correct. I'd heard the same things like, so now now they're just pointing the finger at the moms. And I'm like, I was like, wait, what? How do we, what? Yeah. If you go to a mom and you're like, you stink as a human being because you took Tylenol in pregnancy. Okay. Yeah. Okay. That's going to the mom, but to go, hey, new data has come,
right?
New things have come across. Listen, my kids were eating Pop-Tarts and toaster strudels, and I did not know that Red 40 was a problem, and I didn't know that that was like one of the issues for my middle child who had ADHD. I didn't realize the processed foods were contributing to his behavior until I did my journey, and then I was like, oh, snap, look at that. But I don't go back and like, oh my God, I was a horrible mom. I'm like,
right.
No, it was like I was doing the best I could with the information that I had. And I would love for that to be everyone's mantra because more information comes out every day. Yeah. And again, back to kind of, we're so mad at the opposing side. We're so quick to feel shamed. Mm-hmm. You know, like I'll put a post about Tylenol and say, okay, there might be a link between Tylenol and autism. And some moms are like, well, you're shaming me. I'm like, well, I actually don't know you. Right. And so it's not, if I called you out by name, that would be like, I'm shaming you. So I'm like, I want people to step back for a second, go like, okay, so that message is speaking to me, but no one's actually attacking me. I feel, what am I trying to tell me? It is us shaming ourselves is what's really happening. When is an event, you're like, oh, I'm a bad mom because I took Tylenol. I'm a bad mom because I gave my kids processed foods. That's us shaming our own selves. And that's got to stop. Because if we are kind to ourselves as women, and we are just not nice. As women, we are not nice to ourselves. We are so mean to ourselves. We say stuff to ourselves that we would never say to another human being. And everyone that agrees needs to leave a comment because we are mean to ourselves. And that's part of the shaming process is like, ugh, one more horrible thing I did as a mom. Right. That's another horrible thing. And I would love for us to go, I have done the best I can with the information I had at that time.
Yep.
And I am grateful for new information so I know and can do better.
Yeah.
Done.
Agree 100%. And out of this, all the conversations coming out lately, number one, I'm thinking, yeah, I've known about this for 15 plus years. So this is not new information. And two, I never for 1 second felt as though someone higher up was trying to make me feel bad. Never, not for a second. I, in my heart, knew at the time when I was doing everything with my daughter, I was doing the best that I had with the information that I had. And so, you know, I don't take that on at all. And there's nothing anyone can say that is going to make me feel bad about the way that I lived my life at that time, even though, yeah, sure, they want to try. But that's what we're all doing as humans, is just doing the best that we can at that particular time. And when we get new information, then we get the choice to make different choices and take different actions. Yeah.
Absolutely. Absolutely. Well said.
Amazing. Well, I know we're about at the hour, and you are, as I mentioned in the beginning episode, you run your own practice. You run a social media with 350 plus thousand, 400,000 followers, YouTube. I mean, you're just Wonder Woman. I don't know how you do it. So I'm not going to keep you past the hour, but is there anything else that you think people that are listening need to know about that we didn't talk about?
I would say the one thing that I see a lot of parents with kids with eczema, they play this game called eczema whack-a-mole is what I like to call it. And it is like, I listened to a great podcast, so I'm going to do a little vitamin D. And I've done it for 2 weeks, but it didn't see any results, so I stopped it. Yeah. Then I went to Costco and I saw tallow. I heard about tallow, so I'm going to use tallow, use it for a week. The skin gets red. I'm going to stop it. Oh, you know what? I heard about this detergent that I'm going to use. I'm like, okay, I don't see anything. I'm going to make this dietary change for a couple weeks. You know what? It's really hard and I don't see anything, so I stop it. You do a little, you stop it. You do a little more, you stop it. You do another thing, stop it. It's called eczema whack-a-mole. And when we play eczema whack-a-mole, which is the worst game of all time, we're not going to get any results. And at the end of it, you feel like you've tried everything. Mm-hmm. So people come to me and they're like, we've literally tried everything. And you have. Yeah. You literally have tried everything, except we've tried a little of this and a little of that with a little of this and a little of that. We have never followed a systematic way of healing. Yes. And when you find a systematic way of healing that somebody can help you with, that's when we get to the other side. Because people are like, what's the one thing that I can do for my child with eczema? Find someone who knows how to do a systematic way of healing to get you off chronic meds. Partner up with a person that it looks beyond Dupixent and traditional models. Mm-hmm. That's the one thing. And the one thing is, what is that path that I need to jump on? Follow through, not jump off and on, but just follow through all the way to the end to get to the other side. So I would love for people to stop playing eczema whack-a-mole and partner up with folks that can help them figure out the blueprint for their children's healing.
Oh my gosh, that is perfect, because that was us before we found the program. I had a drawer full of different creams, different things that we were doing, and typically it would make it worse. It would just make it worse. And tallow, I'm sorry to say this, was not the thing. It actually made him worse. And I'm a big tallow, love the tallow, but did not help my son's eczema in the slightest, actually made it worse. And so yes to this, all of this. And we'll put a link down in the show notes if anyone's interested in checking out the program. And you've got a ton of free information on your website, on your Instagram. You're constantly giving of, just free stuff all the time. So I just love everything you do. And I'm so excited for my community to meet you. And thank you for giving of your time today. I really, really do appreciate it.
Oh, wait, thank you so much for having me on here, because I think these are important topics that a lot of people are just worried to talk about, don't really know where to turn. So it's nice to be able to have an open conversation about all different aspects that can help our kids overcome this chronic and really debilitating issue.
Yeah, absolutely. Well, thank you. Oh, and if people are just driving along the road and they want to look you up really quick, do you have a website? What's the best way to find you?
Sure. Website and Instagram and TikTok is Annamarie Temple, and one N. Perfect. And I'd love to, that's where we go shopping, and I show you what to buy and what to not buy and what wipes to have and what baby bottles. And because as busy moms, you know what to do, you know what ingredients to look for and not use. But then when you're the story, like, now which one is it? So I try to make your life just a little bit easier.
I love it. Amazing. Well, thank you so much again. And I'll put all those links in the show notes, and I will see you in about 3-4 weeks up in Charlotte.